Obviously, you know a lot about healthcare. But do you also know the new BMW Series 6? This car is really cool. But there's not just the BMW Series 6, but there's the X3, X4, Z3, Z4. And what do all of these cars have in common apart from the three letters? Nothing. Literally nothing. Why is that? Each X4 is unique, even though it is produced in the same factory. So how does this work? Each X4, after leaving the factory or in the factory, is modified to suit the desires and needs of its buyers. Mahogany, no mahogany, turbocharger, no turbocharger, leather seats, no leather seats. So, in an age where we have personalized cars, it's really high time that we have personalized healthcare. And how this is going to work, I'm going to pass on the word to my more competent team member, Joël, who is going to explain you the future of healthcare in personalization.
I don't think we will make a personal drug for everyone like a personal car, but perhaps we can make drugs for groups of persons, what would be way better than what we have at the moment. So what we are going to do now, we will explain you what our group has found out in this week with this picture of a tree. The first topic are the roots of the tree. These roots represent the foundation we need to come to personalized healthcare. Then we have the trunk of the tree. The trunk of the tree is like how personalized healthcare will look like. And then we have the tree top. Here we have rather positive side effects and rather negative side effects of personalized healthcare. So starting at the bottom. Let's start with ethics. I think I'm not going to talk much about ethics because the group before did this already. Let's just say ethics is an important foundation for personalized healthcare. Let's go on to the second topic, business and law. There we have some challenges. In the legal topic, it's like laws that forbid or restrict the use of genomics and the use of these informations. And it's the big investment that's needed in research to come to a really personalized healthcare. And the question is, who will invest? Will Roche invest for everyone for a drug, or will they just invest for a few rich people? Yeah, I think that's a really important question. Next topic is life science. I think that's like R&D, how do we do science? The last group told you a little bit about it, and what we can say is we have a lack of knowledge. We don't know enough to really make personalized drugs. So we have to know more about genomics and proteomics. If we understand them, we can adapt the new drugs to groups of people. And the fourth and last foundation we need, that was also mentioned before, is a database. Because the problem is that we have a huge amount of data if we could analyze the genome. This amount of data would be so huge that no doctor could work with it. It's simply too much. So we think we need a database that collects all this data and work with it so that doctors can use the data they really need. And we could use e-technology like the iPhone to collect data from the patient. So now we have our personalized medicine. What will it change? It will change a lot for the patient and the physician. The physician will need to know a lot more about how genomics and proteomics and pharmacogenomics works. I think some of you don't even understand this word. I didn't also. So it's time that the physicians learns them. But only if they understand how the things are working, they're gonna give drugs to a group of people that really need them. Only if they understand, they can make tests so that they find out who needs which drug. And only if they understand how it works, they can interpret the results of tests and advise patients how to use these new drugs. So let's imagine we are here, everything functions, now everything right, totally brilliant world without problems, everyone healthy? I don't think so. Perhaps there are some challenges we will have to face if we do it like this. The first challenge is privacy. There is a real big issue when such a huge amount of data is collected in a central database. So we have the risk of abuse of this data. Insurance company could use it to exclude risky patients from their insurance, or other company could use it, could make genetic discrimination and employ only persons with good genes. So I think that will be a challenge we have to face. Another challenge is how we inform our patients. We have to know, let's say Fabian has a disease, and me too. And now we go to the doctor, and the doctor says, yeah, you have the same disease. For me, there's a drug, because I have the right genes, but Fabian, sorry, go home, no drug. It won't work like that. Fabian won't understand it. Why should he? So, no, if we don't tell him why it's like that, he has no chance to understand. So we need a real good information of our patients. The next big topic are the costs. Costs are always a topic. We have fear that, that when we target only this small group of patients, the costs will rise because you can sell less of your drugs, so you will have to make them more expensive. And we have also a fear that with this huge investment in research, you will have higher prices for your drugs. But perhaps it's totally in other way. Perhaps if we have personalized healthcare, then the treatment will be faster. So you don't have to spend less time in the hospital, which is also really costly. Or you do not have to waste so much drugs, which are not really, which are rather ineffective. So I think the costs are a challenge in which we don't know in which direction it will go. The next challenge, that's rather a little positive one, is the drug development. We imagine that we could improve drug development because when we know more about genomics and have more data, we can use this to produce faster drugs. And then we have the idea that the treatment will be more effective. Because if you have a drug for a small group and this drug works on this group, probably it won't work for Fabian, but it will work for the group. So for the group of person it works, it's a really good drug. It's a more effective drug. And the last topic is prevention. We could also improve prevention if we knew more about the genomics of all of us. We could say, yeah, you have a high risk for that disease, so let's do this sport. That would also lower the cost. So when we really can do this prevention, it's a, I think, bright idea. And personalized healthcare won't stop like this. It's like a circle. If we've reached the top, if we've successfully used a drug, we will give information back, like an apple or a leaf that's falling to the ground, and gives new informations to the research and development. So we would need a feedback system. To summarize it all, if we want personalized healthcare, we need the foundation, especially a database. We need to make our thoughts about privacy and about the costs. And in the end, we will need the feedback that everything goes on and we can develop new drugs. Thank you for your attention.